The dangers posed by antimicrobial resistance have been known about for decades. However, with rapidly increasing levels of resistance in recent years, the world is only now waking up to the dawning reality of just how unforgiving that future may be.
Antimicrobial resistance, AMR, is the rise of superbugs that don't respond to treatments, and that means people die. We know from modelling that if we don't take effective action, then by 2050 there'll be 10 million people dying every year of superbugs, of AMR.
Fran Husson is just one of millions whose fragile health leaves her vulnerable to AMR, even after surviving several life-threatening illnesses, including leukemia and C. diff.
I've also suffered from MRSA. The hospital team needed to use last-line antibiotics, without which it would have been life-threatening. If we no longer have antibiotics and surgery becomes impossible, I just don't know how I'll be able to cope.
What drives AMR is using treatments, antibiotics, for bacterial infections. So we've got to make sure we use them appropriately.
Put simply, we need to keep antibiotics effective, which means reducing the number of prescriptions to when they are really needed.
There are different ways we can improve antibiotic use. One is by behavioural interactions, and transparency in data is important in that. When I was the Chief Medical Officer for England, we were well aware that there was overprescribing of antibiotics. So we set out to use a behavioural intervention. There was a Behavioural Insights team, so we went to them for advice. They are experts in this, and they helped us design a trial.
Using behavioural insights methodology and a randomised controlled trial setup, a letter from the Chief Medical Officer was sent to primary care practices with higher antibiotic prescribing rates, providing them feedback that their prescribing level was higher than that of their peers.
By understanding the target audience and their context, Behavioural and Cultural Insights helps us to design more effective interventions. So we asked Dame Sally Davies, the Chief Medical Officer at the time, to write to high prescribing practices and show them how their antibiotic prescribing compares to other GPs, demonstrating that they prescribe more antibiotics than their peers.
I would feel very positive if my GP had received a letter from the Chief Medical Officer.
So this letter highlights to them that their prescribing data is actually monitored, and it also suggests actions they can take to reduce it. It's what's called a social norms intervention. The study was part of the government's target to reduce antimicrobial resistance by reducing antibiotic prescribing by 4%. Using behavioural theory alongside randomised controlled trial methodology means we know exactly how well it worked, as well as how it worked. The intervention led to 73,000 fewer antibiotic prescriptions over 6 months. That's a 3.3% relative reduction in antibiotic prescribing.
We reduced prescribing in general practice, saving £93,000. So it was worthwhile for the patients and the health service. And interestingly, other chief medical officers have followed, the Australians, the Scottish, and this intervention has worked for them too.
This is a very good intervention which can be applied globally to combat what is probably the greatest threat to humans.